Hi, I'm Sam and I'm the lead cancer treatment nurse here at South Warwickshire University NHS Foundation Trust. The team and I know how daunting starting treatment can be and hope that this video will alleviate some of the anxieties or worries you may be feeling. Following this video, you'll be invited in to meet with one of our cancer nurses and have an opportunity to ask any questions you may have. We work across two sites, the Rigby unit at Stratford Hospital and the Aylesford unit at Warwick Hospital. But we are all one team and we are here to support you every step of the way. Your place of treatment may be decided upon where you live or by what treatment you've been offered. Let's take a look at the units. The Rigby unit is in Stratford Hospital, where you can follow the signs for the multi-storey car park and then go into Building 1. In there you will find a cafe and pharmacy on the ground floor. To get to the Rigby unit, you need to get to the second floor, where you will find our reception.
Hello, sweetie. So you're coming for an appointment today, is it?
I have, yes.
You can attend your clinic appointments, blood tests, for treatment, or to see one of our team based at the Macmillan Information Centre. The Aylesford unit is in Warwick Hospital and has its own designated entrance. You can park directly outside the unit or in any of the other hospital car parks. Similar to the Rigby unit, you can attend clinic appointments, blood tests, for treatment, or to see someone at the Macmillan Information Centre. You can find the cafe and pharmacy inside the hospital if you follow the signs in the corridors. Car parking is free for patients who attend either unit for their treatment. It is important that you enter your car registration on the screen that you can find in reception on both sites.
Oh, hi, is that Jeff? Hi, Jeff. My name's Sophie from the Aylesford and Rigby Units. How are you? Good. Now, the reason I'm calling today is because I had a referral come through from your consultant to get you started on some treatment with us. Is that correct?
After meeting your consultant and your treatment options have been discussed, one of our treatment coordinators will contact you to book a face-to-face or telephone appointment with one of our cancer nurses. Please do let us know if you have any additional needs or if you require an interpreter. At your appointment, you will meet one of our nurses who is fully trained in caring for patients receiving anti-cancer treatment. You will have the opportunity to ask any questions. We will also confirm your height, weight, and carry out some investigations, such as a blood test.
Treatment can be administered in tablet form, injection, or intravenously through your veins, which is commonly referred to as IV. If you are receiving intravenous treatment, your nurse will carry out a simple assessment of your veins. This is important to ensure that the right administration device is offered to you. Treatment can be administered through 3 different administration devices. A cannula, which is a small tube inserted into either the back of your hand or your forearm. This is inserted on each day of your treatment and removed after each attendance. A PICC line, which is a long-term device, is inserted prior to your treatment starting. One of our nurses who have had extended training will insert this for you. A PICC line is inserted into a vein in the upper arm and remains in place until you have finished all of your intravenous treatments. The final option is a port, which is a device that is inserted through the veins into the chest and inserted at our local Coventry hospital. This is also a long-term device that remains in place for your treatment duration. Both PICC lines and ports are also known as central lines, so you may hear this term used. The type of device offered will also depend on what medication you are being given. Your nurse will provide you with written information about key aspects around caring for yourself during your treatment. A respect form will also be discussed with you at this appointment. The respect form is a recommended summary plan for emergency care and treatment. This will empower you in discussions with your consultant in future appointments. It is a process that creates a personalised recommendation for your clinical care in the event of a life-threatening emergency situation, where you may not be able to make decisions or express your wishes. In these sensitive and compassionate conversations, we encourage you to bring someone with you. This appointment will take a maximum of 1 hour.
Hello, my name's Ashley. I'm one of the cancer nurses trained in caring for patients receiving anti-cancer treatments. You may have been offered chemotherapy, immunotherapy, or a combination of both, depending on your cancer diagnosis. Let me explain a little bit about each one.
Chemotherapy is the use of specialist medicines and works by attacking fast-growing cells within the body. Chemotherapy can't distinguish between cancer cells and healthy cells, so some healthy cells may be damaged, causing side effects. Chemotherapy is given in cycles, with treatment days followed by rest periods for recovery. The number and length of cycles depends on your treatment plan. Treatment may involve a single drug or a combination. Common side effects include tiredness, low blood counts, hair loss, diarrhea or constipation, feeling sick or being sick, a sore mouth. Depending on your diagnosis and chemotherapy treatment, we may be able to offer you scalp cooling, which aims to reduce hair loss, thinning and promote regrowth. Neutropenic sepsis can be a life-threatening complication of chemotherapy and can occur when a person has a low immune system and an infection, requiring urgent assessment and treatment. We advise that you regularly monitor your temperature. A normal temperature is 36.0 to 37.4 degrees Celsius. If your temperature exceeds 37.5 degrees Celsius twice within an hour, or goes above 38 degrees Celsius or below 35.5 degrees Celsius, contact our Acute Oncology 24-hour helpline immediately. Even if you have a normal temperature but are feeling genuinely unwell, you must call the Acute Oncology 24-hour helpline for further advice. Immunotherapy is a treatment that helps your own immune system attack and fight cancer. It works by boosting your immune system to recognise and attack cancer cells. There are different types of immunotherapy drugs. Some strengthen the immune system while others help it detect cancer cells. Immunotherapy is given in cycles, with treatment days followed by rest periods. The number and length of cycles depends on your treatment plan and may involve a single drug or a combination. Common side effects include inflammation of the lungs, causing shortness of breath or a cough, inflammation of the bowel, causing diarrhea, skin rashes, joint pain, and tiredness. If you develop any side effects or are feeling unwell, you must call our Acute Oncology 24-hour helpline immediately for further advice.
On your first day of treatment, please do not worry. We know that this is an anxious time, but we are all here to support you. Please drink plenty, have your breakfast as normal, and remember to take any regular medications unless you are instructed otherwise. You will be welcomed by one of our clinical support workers or treatment nurses and taken to the unit. We always check your weight and some general observations, including blood pressure, temperature, and heart rate. This is to ensure you are well to receive your treatment. Your nurse will go through some important information with you, and you will have the opportunity to ask any questions that you may still have. Please remember to bring your signed consent form to this appointment.
Oh, is that your consent form?
It is, yeah.
Let's have a little look. I'm just going to sign this as well now.
Okay.
Would you like a copy?
Yes, please.
We will insert a cannula or access your central line if you have one, and begin giving your pre-medication. In most of the treatments, these medications can be anti-sickness, antihistamines, steroids, or a combination. Antihistamines and steroids can help to reduce any reactions that may arise when you are exposed to a new drug. If at any point during the treatment you feel unwell or develop any new symptoms, please let any member of the nursing team know. Although uncommon, extravasation can occur when treatment is being administered. Extravasation is when chemotherapy or immunotherapy drugs can leak outside of the cannula or central line into the surrounding tissues. Some symptoms of extravasation can be burning, stinging, pain, swelling, or redness. Please alert your nurse immediately if you have any of the above symptoms, so an assessment can be carried out and treated promptly. Some cancer treatments may be given through an injection in your tummy or leg, and you may also be sent home with chemotherapy tablets to take. Your nurse will explain everything further on the day of treatment. You will be provided with hot drinks, squash, and water while in the unit. We also have a vast variety of biscuits that you can choose from. If your treatment falls at lunchtime, we will also provide you with lunch. You are more than welcome to bring your own snacks and drinks. You may meet some of our amazing volunteers who come to help with hospitality. We provide iPads if you wish to use them while in the unit, and there is a free internet service. Please let any of the team know if you would like to use these or if you need help getting set up. Before you go home, your nurse will ensure that you have your next clinic appointment, blood test, and treatment date booked. It is important you attend your follow-up appointment with your doctor or specialist nurse. A blood test is required before each cycle of treatment to ensure you are well and blood counts have recovered. Usually blood tests are booked within 48 to 72 hours prior to your treatment. However, with some regimes, bloods are only needed within 7 days. With most of the treatments, we will also give you some supportive medication, such as anti-sickness and steroids to take home. You may also have some injections prescribed. These are called filgrastim or GCSF and help to boost your immune system. Your nurse will explain further on the day of treatment. Please remember you are very welcome to bring a friend or family member with you, and we strongly advise that you do not drive on the day of your first treatment. There are some medications where we would advise you not to drive on any treatment days, but your nurse will let you know if this applies to you.
Hi, I'm Sharon, lead acute oncology nurse here at South Warwickshire University Foundation Trust.
If you are experiencing any worrying side effects, our acute oncology service provides a specialist 24-hour advice helpline. A trained nurse will assess your symptoms and you may be asked to attend hospital for a clinical review or be given advice on how to manage simple side effects at home.
Can you describe that for me?
When you attend for your first treatment, you will be given a card with the Acute Oncology mobile number and an emergency pack to present to the emergency department if you're advised to do so. It is important you always keep this number safe and with you.
Should I carry my pack with me every time? Yes, so anytime
you will be given a just-in-case pack that should be brought with you on hospital attendance. These packs will be specific to the type of treatment that you are having, or a combination pack if you are having combined treatments. Biospecific treatments will have a green pack. Chemotherapy treatments will have a red pack, and immunotherapy treatments will have a blue pack. Different coloured packs may be issued in the future with the release of new drugs.
You should never attend for a clinic appointment, a phlebotomy appointment, if you are feeling unwell at home. If your temperature is above 37.5, then you need to call the acute oncology team for further assessment.
Hello, my name's Zoe O'Neill. I'm a nurse consultant in cancer care at Warwick Hospital. We hope you found the video informative and it has helped relieve some of the anxieties you may be experiencing. We as a cancer team are here to help you and your family get through this treatment. So please do not hesitate to contact us. We are happy to help in any way that we can. We really look forward to meeting you at the start of your treatment.